Hi there, I'm Mary Toman. I'm a fourth-year nursing student at USM. I chose nurse staffing ratios as my capstone topic, and the reason I chose this was because it was really interesting to me for a couple of reasons. One was that throughout the pandemic, I've been hearing a lot of talk about nurse staffing ratios. So I wanted to explore this a little bit further and research how the number of patients that a nurse is responsible for, how it affects that care of the patient. Another reason why I was interested in this topic is because of the union debate that's going on at Maine Medical Center. I also wanted to do a little bit more research of my own into this so I could kind of see how it related to that debate as well. I'll start off by explaining that my research question that I chose was as follows. In patients in a hospital setting, how does a higher patient-to-nurse ratio compared to a lower patient-to-nurse ratio influence the outcome of patient care over the length of a hospital stay? In my research, I came across 6 studies that helped me to answer my PICO question. The database I used for my research was CINAHL with full text, and the keywords that I searched were patient-to-nurse ratio, patient safety, patient care, patient outcomes, nurse safety, and nurse burnout. So of the 6 studies that I found, 3 of them were experimental and 3 were non-experimental. This being said, no matter what type of study it was, all of the 6 studies reached the same conclusion. The conclusion of the studies was that a higher patient-to-nurse ratio has a negative impact on patient care and safety, and it also has a negative impact on nurse safety. So increased staff leads to positive patient outcomes and positive nurse outcomes. As you can see on my poster, in the results section, it has some evidence from a couple of the studies. So one of the studies that I found in my research was a study that took place in China, and in this cross-sectional study, the rates of falls, hospital-acquired illness, hospital-acquired pneumonia, and hospital-acquired pressure ulcers were obtained in 13 different hospitals. So the survey monitored how nurse staffing affected these 4 outcomes, and the results of the study showed that a nurse-to-patient ratio was significantly related to the fall rate on each unit. In addition, an additional patient per nurse on average increased the yearly fall rate to 0.02%. In comparison to the study done in China, I found a study done in a hospital in Brazil. It was a cross-sectional study, and in the units with a higher number of patients assigned to nursing professionals, there was an increase in the patient's mean length of stay and in the incidence of urinary tract infections related to invasive procedures. In addition, the last result I'm going to talk about was a systematic review and meta-analysis that compared and contrasted 35 cross-sectional studies about nurse staffing and nurse-to-patient ratios. This review found that a higher level of nurse staffing was associated with a decrease in the risk of in-hospital mortality and in nurse-sensitive outcomes. So for every increase of 1 nurse, patients were 14% less likely to experience in-hospital mortality. That's quite a large jump. My results just go to show that no matter where in the world we look at. Nurse to patient ratios are something that we need to fix. After synthesizing the results of the 6 studies, it's very clear that all evidence is in agreement. All 6 studies support the claim and conclusion that a higher patient-to-nurse ratio has poor effects on patient safety, patient care, and patient satisfaction, as well as nurse safety and nurse job satisfaction. The research done does in fact answer the question that I asked. Due to this information that I gathered, I believe it's important, and I recommend that patient-to-nurse ratios be continuously monitored and altered throughout patient hospital stay, depending on the number of patients as well as the acuity of patients. The nursing implications that this topic has is that in some hospitals, staff ratios have become such an issue that nurses are wanting to unionize, like we see at Maine Medical Center. This being said, the main reason that nurses want to unionize is so that they can have more of a say when it comes to issues such as patient-to-nurse staffing. In addition, as I've seen throughout my research, a lower nurse staffing level may lead to nurses being forced to take mandatory overtime shifts. This can have a really detrimental effect on the state of their mental, physical, and emotional well-being. In addition, nursing burnout is a large consequence that comes with a high patient-to-nurse ratio, and it can lead to a lot of negative results. Nurse burnout can lead to nurses making mistakes during patient care, and can also lead to nurses not enjoying their jobs and wanting to leave their jobs. I believe that hospitals should have policies that make it mandatory for there to be a certain number of nurses, depending on how many patients are on a unit, the acuity level of patients, as well as the experience level of the nurse. Down below, I have my references for my project. Thank you for listening. I hope you enjoyed.